Dr. Anthony Fauci said Americans shouldn't hesitate to spend holidays with their families if they are fully vaccinated. For the latest on COVID and the vaccines, CBS News medical contributor Dr. David Agus joins us from Los Angeles. Dr. Agus, good to see you. The FDA Advisory Committee recommended Friday that all J&J recipients get a second dose. Should that second dose be J&J or another vaccine?
Well, Nikki, 15 million people in the country got that J&J vaccine and are basically waiting to see what to do. The recommendations are going to be 2 months after that shot, at least, you should get a second shot, either J&J or the RNA vaccines. You know, the J&J probably was meant to be a two-shot vaccine, and so getting a second one will raise immunity. Getting an RNA vaccine as a second one will raise it even more.
On the topic of mixing and matching, which we're all curious about, which provides better protection, mix and matching vaccines or the same vaccine for all doses?
If we take an antibody level as a surrogate for how much immunity you get, probably mixing gives you slightly better protection with slightly more side effects. And so I do think getting the same one is okay, and you will get enough protection to get you through Delta. But if you want a little bit more protection, mixing may have some benefit.
We see Minnesota hitting another critical COVID point with hospitalizations peaking again. Is our country going to be in a better or worse position as we kick off the new year?
You know, that's, you know, if I had that, I could, win on Vegas. But I certainly think now we're doing better against Delta. We're vaccinating 57% of the country. And as the next couple of weeks, we're going to start to vaccinate children 5 through 11, should that get approved. And I think it will. And that's another 28 million people on the roster that can be vaccinated. So I think we're going to be in a much better situation at the end of the year. And I would vote good that around the holidays, we're going to be back together without really worrying.
Dr. David Agus, thank you.